the country sort of that was set up to free the slaves. I think that's where it goes back to.
Send them back. Send them back from America.
Yeah, that's the ones. Try to.
Rightio, everyone. Welcome to the West Wimmera Shire Council July meeting. If everyone could please be upstanding. David, if you could read the acknowledgement and the opening prayer.
Thank you, Mr. Mayor. The West Wimmera Shire Council acknowledges the traditional custodians of the land on which we meet and pays respect to their elders past, present and emerging. Let's pray. Almighty God, we humbly ask your blessing upon this council, guide and prosper our decisions to the advancement of your glory and the true welfare of the people of West Wimmera Shire. Amen.
Amen.
Have we received any apologies?
Mr. Mayor.
Are there any leaves of absence?
No.
Does anybody have any conflicts of interest they need to declare? I do for confidential agenda item 18.1, the termination of the lease at Canova Aerodrome. If anybody else finds any during the course of the agenda, please declare them. Question 5, 5.1, agenda item 5, 5.1, written questions on notice. Have we received any written questions on notice?
Received, Mr. Mayor.
If not, verbal questions without notice. We do not appear to have a gallery, so I don't believe we need to go to that item. Item 6, our delegates' reports. Again, I've had quite the busy month. I actually looked at my calendar from the previous month and there was only 3 days of the entire weekdays of the entire month where I didn't have some cancelled meeting, and even 2 weekends were tied up as well. So if people think we aren't busy, well, we are. I attended a Timber Towns meeting, and again, that was quite a productive meeting. We learned a lot about a few new areas of production, which might be useful for blue gums, which is relevant to our region. I attended the Elder Conference in Canberra, which again was quite a worthwhile exercise. Again, it wasn't a sitting week, which made it quite disappointing. There wasn't the chance to have a lot of meetings with government ministers and the like because they just weren't there. I was able to have quite a productive meeting with both Anne Webster, our local member, and Senator Mackenzie, where we discussed the pipeline and the need to get a pipeline built. We also talked about the service and railway crossing, and Senator Mackenzie is all fired up on that one now, and hopefully we'll be sending a few questions to Catherine King on that. And again, you know, quite a few productive sessions there, and it was just, you go to these things, you sort of never know who you're going to meet, and you wouldn't think West Wimmera would be sort of paired up with Marybeck Council of all people, but we were at the same dinner table together, and we all got along quite well, and it was just quite interesting to hear how much they were actually staggered by the Emergency Services Volunteers Fund as well. And when you got Marybeck and West Wimmera joining forces on an issue, you know you're in trouble. Other than that, I went to the Canova Lions Club changeover, which again was a fantastic event, and we all are very, very appreciative of all the work the Lions Clubs do. Unfortunately, I wasn't able to attend the Edenhope one due to a clash, but Councillor Hobbs filled in for me, and I'm very thankful to her for that. And otherwise, we have been quite productive on our council plan. We've started that, and we've also had our budget pass through as well. So, and the rest can be as read. Councillor Pretlove.
Thank you, Mr. Mayor. As read, only I also attended the maternal child health presentation at Goroke, which was very interesting, and we've got a lot to consider in this meeting when that comes up. Our Mayor has just touched on our community plan workshop, which we spent several hours on Monday. We do have community forums starting next week. I believe there's 3 on Tuesday, so I think it'll be really good to get some feedback from the communities so that we can progress in that area. Thank you.
Councillor Hicks,
It's read, Mr Mayor.
Councillor Hobbs.
Yeah, so thank you. I did attend the Eden Hope Lions changeover dinner. I think it was fantastic to see that it's $32,000 a year going back into community projects. And what was even more pleasing is that they've got 5 new members. So that's really good, encouraging going forward into the future. Council planning workshops. The one that we started on Monday was really good, and I am encouraging everyone to attend those meetings, albeit all of them. I attended the Drought Ready think tank in Horsham too, which was another fantastic day of talking about all sorts of issues, Wimmera wide, and some really good people that I met up with there. The maternal child health meetings, I attend both in the Eden Hope and the Coniva one, and then I've also had other calls that have come after that, and that was good to try and catch up and just listen to the stakeholders that are actually impacted by any changes. And then the Changemaker in Cairns, which was an amazing 3 days that I spent. So some brilliant people, and yeah, new things to implement.
Thank you. Councillor Houlihan.
Thank you, Mr Mayor. First up, I'd like to apologise for being late to the council plan workshop. Very important meeting, and I slipped up. We got there next week, next Tuesday at 9 o'clock, we're at Apsley. 12 o'clock, we're at Goroke, and 3 o'clock, we're at Harrow. So I would encourage ratepayers to be at those meetings. On the 3rd of this month, the 7th, I was online to the emergency services online meeting, not our name. Then again, on the 8th to the 7th, I was online again. We have come up with a major meeting on the 26th of the 7th. This is the emergency services meeting. That's at the Moonee Valley Racecourse. It's Saturday at 11 a.m, 26/7/25. I would encourage as many people as possible to get there and see if we can do something about this tax. It's no good waiting until it comes in and then we should have. Or maybe we just about. We've got to get there and do something about this tax. Hoping for a big crowd of that. That's Moonee Valley Racecourse, 11 a.m, 26th of this month. Thank you, Mr Mayor.
Thank you, Tom. I'm sure you'll have an appropriate slogan on the sign that you carry for the day.
I won't answer that. That's going to incriminate myself.
Yeah. 7, we have no condolence. Number 8, 8.1, previous confirmation of the previous minutes for the meeting held 18th of June 2025.
Mr Mayor, can I move 8.1 and 8.2?
They can be moved on block, so the council meeting for the 27th of June as well. Anyone prepared to second that? Seconded by Councillor Hobbs. Any discussion required? If not, put it to the vote. All in favour? And it's carried. If there's any business arising, number 10, notice of motion. Have we received any notice of motion? None received. Item 11, the council forum record, 11.1.
Move that, please, Mr Mayor.
Yep, from the 2nd of July, that is moved. Anyone prepared to second? Seconded by Councillor Hobbs. No discussion required. All in favour? That is carried. I don't believe we have any deputations or petitions. We have no executive officer report. We moved to item 14.1, which I am going to lay on the table as we need to seek some further information on this one first. which takes us to item 14.2.
Mr Mayor, by point of clarification, how long is it going to, do you want to put a time on how long it's going to lay?
I've
We
just
don't
make,
want it to be dead.
it's not a motion to lay it on the table, it's just been removed.
Remove this item.
It's just removed from this agenda, so it should come to our next forum and meeting.
Okay.
Yeah, it actually hasn't been moved to be laid on the table, it's just been removed from the agenda. 14.2, yeah,
Could we, so it'll come to the next meeting.
that is the intention.
We'll go back to
We
it.
we are talking about basically a volunteer organisation here who could be hit pretty hard financially, so.
Yeah.
So if we could get that to the next meeting, please.
Yep.
Thank you.
14.2, provision of maternal and child health services.
So thank you, Mr Mayor. So report as read, however, we'll just give a brief overview. So we conducted the community consultation in-person forums. There was 3 forums that were conducted, one at Edenhope, one at Goroka and one at Coniva. The synopsis or the overview of those forums is in the report. However, it was well represented. There was 14 odd families or community members in Edenhope, sort of 5 or 6 along with some staff in Coniva, and 4 attendees in Goroka forum. Very passionate about the service, some really positive feedback in regards to how the service is operating at the moment, and a really strong connection to the service. There were some passionate people about keeping the service within council's control, and likewise some people sort of understood that the model may change going forward. Yeah, is there any questions, comments?
Hang on, where do I start? Give me a moment, someone else go first.
Anyone else have a question?
So Dalton, just to confirm that if the policy stays with West Wimmera Shire, if the service stays with West Wimmera Shire Council, it is likely to change anyway.
So we understand that there's a significant uplifting in governance, and we're expecting that will impact the service, yes, through a set of policies that will kind of sit on top of this current service. It'll likely be that there'll be a number of restraints on additional services and flexibility we provide because of governance processes. At the moment, the service is very, very flexible, and it's something that our community really values in that service, albeit that provides an additional risk to council in terms of this service is really preventative in the way it operates. Our children meeting milestones at the moment because of the lack of health services within our area or reduced access to health services because of our locality and our remoteness. People tend to build really good relationships with their maternal child health nurses and kind of use them as provision for other health services that we're really not equipped to provide.
Richard?
Dalton, having said that, you're only anticipating, am I right in saying that you're anticipating changes may be made to the implementation modality of MCH, but you don't know yet any timeline nor any indication of what changes may be resultant in the future?
That was quite a good synopsis. Yeah, that's right. We're seeing a number of these increasing in governance across a number of services, particularly aged care is obviously one of them. So yes, we're making informed and educated opinion and guesses as to how that looks going forward.
But there's no indication yet of any specific changes nor any specific timelines.
Yeah, that's correct. Yeah. Again, we've done this service for a long time and done it well, and that was certainly the sentiment of the community. Some of those changes and the clinical governance overlay over this kind of has evolved over time as well that we may not have kept up with as well. So.
So you're suggesting that the changes that we are likely to face, we know we are going to have to do anyway, because we do actually have to play catch up on a few areas, and they will have consequences to the service we are currently providing.
Absolutely, yeah, and that is. Please don't take any reflection on the current practitioners that we have. We have every confidence they are doing a wonderful job. This is a really, from a management point of view, not the practitioners. They are very good operators and doing a great job.
Barry?
So without, if the decision is made here today not to move and transition this service, the likelihood is that West Wimmera, the model we have now, will change. It will have to change. And what sort of cost impact, or what what areas and will we be seeing, will we be looking at, or is it a matter of having an independent body just audit to see what risks we are exposed to?
Yeah. So just a point of clarification, the model necessarily won't change, as in we obviously go out into our community and visit people at home. I'm not a clinician, so please don't think that, but the first visit is always at home. People will still be able to visit their maternal child health in the maternal child health centres in their local town. So in Edenhope, Goroke and Coniva, that model won't change. What is likely to occur, and again, is that we provide a wide breadth of service. This model or this service should be just preventative. It's not reactive to healthcare needs of young children. It's, are they meeting their milestones? Is there any concerns in regards to their development? That is ultimately will stay the same. What we're likely to see is a set of policies that sit above our clinicians, things like clinical governance, clinical supervision. These are things that kind of should happen and kind of do happen, and they have the availability. Things like lone worker safety, the devices for them to be safe when they're working alone or out in the community. These are things that we kind of haven't kept up with or should have done, and we perhaps don't have in place at the moment to really provide that overlay of safety over our service.
Do we actually provide with this is there any free contact with mothers to be, with families, prior to having the first child? Does our service have any, connecting and just with anybody, that is in that position?
I don't know.
Well, like with the perinatal service, yeah, they do.
Yeah.
And I
We
think,
provide that.
yeah, what the big change is the growing complexities of families and their needs, and that's just going to continue on. So, we don't have NGIS wrapped around to just get in there and do that. We have to refer, but we still do all that, but we refer to different services for prenatal and postnatal.
With even a lot of our antenatal care is provided by the health services. Currently, there is none whatsoever in the West Wimmera Shire. So, do people rely on our MCH to get some of that antenatal care then, or is it just it's perhaps not as like they're not getting the blood. Our nurses aren't providing your blood tests and all that type of thing in that stage. It's
Community
more,
nurse.
yeah.
So the health service provide that.
So where does that come from then? Is that through, we're not providing that? That's through a nurse, through the doctor that you would be seeing, basically. All of
And to provide medical, like they're all midwives. Qualified midwives, so they're capable, they're able, but we don't have that clinical governance to make sure safely.
Yes, Richard?
What do you mean by clinical governance? It's a term that's been used around this table a number of times. I don't understand. What's your definition of clinical governance?
Yeah, so having worked in a hospital and not as a clinician, I see a significant amount of resources is put towards this. This is about clinical risk safety, scope of practice, things like hand hygiene, but just
Not really allowed to close the door in a public meeting, I'm afraid. Sorry, not my rules. It's a bit annoying, I agree.
yeah, so things like clinical risk management, scope of practice. Again, I'm not a clinician, but these are all the things I've seen in the hospital, like significant and massive amount of resources. Clinical supervision, so that's like post-incident, you do incident reviews of a clinical nature. Does that kind of answer your question about what clinical governance is?
Sort of, but aren't the current maternal health practitioners, who, as you've said, are qualified midwives, aren't they already providing that? And don't they already have the ability to reference back any issues to a qualified medical practitioner or a hospital service, whether it's here locally or outside?
They can refer anything.
Okay. So if West Wimmera, if it's proposed in one of the recommendations that West Wimmera take it over, West Wimmera Health Service take it over, I don't see what the difference is. Already the maternal health staff have the ability to go back to West Wimmera Hospital, we'll say, to get further information or request additional clinical assistance. That's already happening. So whether the maternal health staff are paid for by West Wimmera Health or paid for by West Wimmera Shire, I can't see there's much difference in the information stream between, if you like, the patient via the maternal health staff member to someone higher up the chain with more, who can provide more qualified assistance or advice.
So that was certainly one of the comments that was mentioned by one of the community members at one of the forums. So that was absolutely, absolutely.
I can maybe just one comment on that is you don't know what you don't know. I think at this stage you are reliant on 3 staff members, and we were lucky up until now. We've had very good staff members, but if you sit with a broader organisation with that higher level of understanding of health services, I just think they are in a better position proactively to do certain audits and to put certain processes in place that we don't necessarily have. So I
Having said
think
that,
to be able to provide that same service sort of without exposing council to risks. I mean, you will really have to leverage external experts to assist you with that clinical governance, because you can't only rely on what your staff sort of report. I think in terms of that obligation on you to provide a safe service, we'll need to take a little bit more than just that.
Having said that though, David, you're still relying on the maternal health staff, who are the interface between the mother, in this case, and the paymaster, if you want, whether it's the Shire or the hospital. It's not like West Wimmera Health Service is going to send out a doctor to undertake more clinical evaluation each time a maternal health person goes out. I don't see the difference whether it's the paymaster is the hospital or the Shire. You're still relying on the professional integrity of our very well qualified maternal health staff, who, as you said, are midwives.
Can we make these questions rather than debate, please? I do have a question first, though, as well. Would I be right to say then, there's no doubt whatsoever MCH staff are brilliant, and they're very well respected and well loved and everything. And I'm sure Tracy's great at her job, and I know you are as well, Dalton. But are we sure that we have enough experience and enough skills to run clinical governance as we're talking? There's a whole lot of risk management there that we perhaps aren't fully aware of. That's will come at a cost for us to raise up. Is that right to say that?
Yeah, I'm talking for myself. I don't have confidence in my own ability to lead these people down a clinical pathway.
No, and that's a risk management question for us.
Yeah.
Jody?
My question is along the same line. Are we, as council, sitting in an area of risk while we continue down this line with the model that we have? With all respect to what is going on, but are we sitting at risk to our council with what we don't know?
I believe there is a level of risk, and that may not necessarily be to our families. It could be to our staff. It could be to the children being born in our shire. With the level of clinical governance overlay, again, with no reflection on the staff that we have, they're brilliant. That we are not necessarily supporting them to do their best job.
Gary?
Is there also, I know that, feedback has been that most people that have been at these forums have been very happy with the service we provide. Is there a possibility under the model that's being offered under the banner that has all the ducks in a line as far as safeguarding with the risk and also access to different allied health services, is there a chance that this might be harder on our young families to access all of what's available now with the network? And given if we did transition, could that make sense in the fact of, if for example, if we have someone with a speech problem or whatever, there's direction and you've got perhaps more, exposure to the professionals needed without multiple referrals and without, may it better position, the mums, the unknown, it might make it easier.
Certainly some of the discussions, West Wimmera Health Service were at these forums and they spoke about them being part of a bigger team. So instead of having to be part of a different organisation, they're part of the same team, so they can have those conversations rather than relaying information either through a referral letter or something, that they direct conversations they can have with other clinicians. And it should expedite that process and hopefully improve the service.
Okay.
And in follow on to that, so, I know in other areas that, having the devices, the IT that we have now, I'm tipping that too could support a mum not having to travel and still having access to further professionals by, just the IT that we do have now.
Yeah.
Is that relied upon a lot within these types of, for example, West Wimmera Health Service?
Sort of. I mean, I don't know what their paediatric service is like. I mean, we all have also heard, the by 5 model may or may not change, the funding's being cut. That's kind of the model and that's where they fit into this service. The interaction with paediatrics, particularly the Royal Children's, by either your local GP or via devices. So there's some complexity around that. Again, I'm not fully across what that looks like, particularly within the health service. But
Sorry, did you mean like telehealth?
Yeah, that's a type of thing.
That's what
Yeah,
they do.
yeah.
So they'll get a GP in Melbourne, a specialist, and they'll organise that telehealth session so that parents don't have to go to Melbourne.
Yeah, that I guess that's it. If you're under a whole banner,
Yeah.
is there possibly some positives in that area that we may be missing now? Like, without having many heads in to help in certain situations.
Yeah. And they have like a forms committee already set up. So they go through every form to make sure it's safe, all that sort of thing. We don't have those sort of
access to.
Yeah, but obviously they're doing that.
One of the issues we face is a lot of our community are cross-border residents. They'll go to Narracor or Watertown for services, and we know the two health systems don't necessarily play nicely. Do you see that being a challenge if another provider was to run the service?
I don't believe so. I believe the health services already interacting in certain ways because they're referring on to additional clinical pathways as well. I believe there's every intent that should the health service, West Rimmon Health Service, operate in Edenhope, they would refer to community health within Grampians Health that operate out of Edenhope, which I know Richard, and that's certainly the comment that come out in Edenhope, is that they already do that. There should be no change for them in that instance. I'm not sure about state borders, but again, they interact already, but I don't know how well they are. Health is state funded, so.
It's a problem that this one might not solve necessarily. Any further questions?
Not from me.
Was anyone prepared to move a motion then? Does anyone have further questions?
No, I'm going to ask one more question because I've just highlighted this. So I noticed in the report we are writing, we have got here that our council may not be compliant. So I guess the word may. So are we, or are we compliant? Or not with the framework of what we have to have now to deliver? We're obviously.
Are we currently compliant or not?
Yeah.
I assume we are. Otherwise we'd be closed down.
Yeah, so I don't know. I don't know if we've had a clinical review. If we, so a health service undergo that, they're registered, particularly ones that do aged care, are registered under the ASQA. So trying to think, it's the Australian Government for Aged Care. So, and then also the Safer Care Victoria as well. I'm not sure how our registration works currently.
Well, it's like sort of under MAP, but they don't do the actual audits or anything. It's up to your organisation to do a self-audit and that sort of thing.
Righto. Just one more then. This model with West Wimmera Health Services is implemented in Hindmarsh and Yarriambiack.
Yes.
Yarriambiack. Is it, I was at Goroke and I feel that it is successful, but we, word is it's been successfully implemented. Is that correct?
Yeah, that's certainly the information we received from the health service. They may have a vested interest in obviously putting that in the best light, but they felt that it was reasonably successfully implemented. Obviously, no changes without teething issues. As far as the transfer happened at Yarriambiack this year,
1st of April.
Yeah, that's right. The maternal child health nurses operated out of the same building that they did on the 31st of March. They operated under the same team leader within the structure. That team leader then reported to a person in the health service rather than in council. Again, same building, same service, same box.
Yeah. Without really any change to the, some wouldn't have really noticed the change other than uniform. Sorry, I'm just getting my. Yeah,
I've got some more questions now.
Now, another thing here. So, if we are to remain how we are today, there's an option here that in front of me that tells me that we would quite possibly or be suspending home visits and immunisation services, just simply to make sure there's no risk under the banner that we have now. So that is something that is probably real, and we could see quite a few changes just to have to alleviate any risk for council.
So that's two of probably the biggest areas of risk. So one is that lone worker safety, going out into someone's home,
Yeah.
The safety of our employees, and how can we get additional tools or services for them to kind of be safer in those instances. And obviously immunisations and medication are obviously really a high risk area as well.
But it's only an option.
Yeah, sure.
Yeah, I know it's only an option, but it's still something that we need to
Consider.
Absolutely. What it's looked like may not look like.
So is it right to say West Wimmera Health Service has been running the one in Highmarsh for about 20 years?
That's correct. Yeah.
And Dimbula Hospital is not part of the West Wimmera Health Service?
No, that's correct.
And so parents who really receive MCH in Dimbula, they aren't forced to travel to Nil or anything like that?
I don't believe so.
No, I don't believe they are either. No, so there's no suggestion that parents from here would have to go to Nil to receive MCH?
No, that's correct. So they operate, West Wimmera Health Service currently operate a service in Goroke and Caniva, and we have also offered our current facilities to the health service to continue to operate out of. So whether they chose the current facilities that they operate out of or their own facilities within the town, the intention is that they absolutely would not travel for those services.
I think it's also true that there's no doctor in Goroke. It's not.
Yeah.
So if you remove the vaccination process, if we continue with the service and you say there's an option or a possibility or whatever, the vaccination will be removed.
So that would be temporary while we...
Well, where would they go for vaccinations? They can't go to Goroke, there's no doctor. The Caniva doctor has in the past been spasmodically vacant. So it may mean that they'll have to go to Nil for vaccinations.
So that would be if we were to choose to continue to operate the service and suspend it temporarily while we uplifted our clinical governance around those models.
No guarantee though that West Wimmera Health might have to do the same.
So
they might have to also pull the vaccinations then. It's
They already have some provider, so they.
So yeah, I believe that their governance would be right to continue that on.
They've already provided.
Yeah, that's right.
You would
Yeah.
assume that they're already.
in Nil.
Because they have a immunisation manager.
Yeah.
Manages all that.
If it did come down to that though, and well, not necessarily on the vaccinations, but just in years to come, and we never know what's going to happen with hospital amalgamations and all these types of things. If the services were withdrawn from our shire and people had to travel, what options would council have to take the service back?
I suggest it would be negligible, very minimal.
Nil.
Yeah. I mean, I don't talk for the health department, but
Once
we all
once
know.
we hand over the service, it's unlikely we could request it back no matter what
I
happens.
suggest so. Yeah. I also personally, I don't see this as handing on a service. I see it's partnering with. Yes, they have ultimate control, but like any service that are offered within our community, we have vested interest in things being available, really good services being available to all of our communities. We absolutely want children to be born here because we will have a vested interest in a strong population.
We've got a vested interest.
Well, don't we? So to not provide a really good service here, is ridiculous on our own behalf. So if it's not fit for purpose and not well, the first person we're going to see is the CEO of the health service to say the service is not good, improve it.
Yeah, you've spoken about the medical services, Goroke, Caniva and Edenhad. What about the Bush Nursing Centre in Harrow? Will that be affected in any way, shape or form?
I wouldn't believe so, no.
Thank you.
Any other questions? Alan?
Just a question. The NDIS and paediatric services, where are they presently administered from?
Nil, I believe.
Is now, yeah.
So if we needed that sort of service, Tracy, where is that how does that work now? Does a mum see one of our nurses and then they refer them to one of those professionals at NIL?
Or Eden Hope, like if.
Yeah,
if-
yeah,
if there
yeah.
was-
I'm not sure that Eden Hope have NDAs.
No, but they may not come to NIL, they may go to
Yeah, they
Horsham.
might be
So
Ballarat.
they can be referred on essentially to any other provider.
So it's fair to say the biggest risk with this to council is just all of the governance.
Clinical
That's it.
governance and governance.
It's above us. It's whether we've got it all in a row to withstand anything that comes from left field. You know, whether it's with the immunisation service, the visiting home, we will have to really sharpen up that umbrella that sits above us and really look into it if we were to remain how we are now, because at the moment we question, are we sitting at a risk?
We may or may not have to change the rules regarding clinical governance. Right now, there's no deficiencies that have been highlighted with regard to the way that we operate under clinical governance. You're just presupposing that in the future we might have to, and the rules might change and tighten it up. Right now, to say that we're not compliant with clinical governance, immediately we've shot ourselves in the foot. So you've got to be careful how you go into that, because if we say we're not compliant with clinical governance now, then legally you're looking a bit dodgy. So I can only assume that right now our clinical governance is appropriate to the actions and activities that the MCH staff undertake. But in the future, the rules and regulations regarding MCH may or may not change, and that will be something that's outside our own control. It'll come down from the federal or the state ministries of health. And we may or may not have to respond when that happens, depending on what the changes might be.
Wasn't a question again, but so as the board of directors, can we be held responsible for what happens with this service?
Yes.
Yes. And if we are aware of risks and we don't do anything to resolve those risks, does that make us even more likely to be responsible? I would say too. And I would say we are very, very aware of risks. To say that we aren't, flies in the face of what we'll pass in our minutes of our next meeting from the forum.
But driving a car, you're also responding and being involved in risk. If there's risk if we're currently exposed to risk, then we should have taken appropriate actions to mitigate that risk. I'm assuming that right now we're aware that of potential risks in the future, but there's no obvious risk right now that might jeopardise our clients or our staff. Because otherwise, you'll find yourself with a legal action.
Well, I think this proposed action is a response to those risks.
Tracy?
I just want to highlight too the incoming child safety and reportable conduct that's going to come soon, that we're going to have to train all counsellors, staff and that sort of thing. And that's an added risk, obviously, with early years. It's across the Shire, but it's also MCH as well, that we need to make sure that
So we know there are some legislative changes coming, which is going to involve.
which we can do.
Yeah.
I think, Mr. Mayor, it's not only the changes that's coming; it's also it's also what's required at the moment. I think Tracy has mentioned that a healthcare organisation has got a dedicated person, for instance, looking after vaccinations. We don't have that dedicated person. So although we might just comply with everything at the moment, I mean, you don't know what you don't know. And I think if there's a larger organisation with more robust structures and more people that can help you to to audit and governance and make sure you've got all the right requirements in place. I believe they are just in a better position to be able to do it.
Any further questions?
Just wanting to clarify, one of the things that was said at the meeting was that this is not about cost, but then there's sort of like a bit of a double messaging that it potentially will cost us more into the future. So will it cost it? What is the story with cost? It is about cost or not about cost?
So
It's more about risk, is that right?
yeah, that's right. Yeah, and so everything has a cost. Going through a clinical review and a gap analysis will cost. But there is a kind of a model that is already mature, that is already operating, that has, I suppose, the services and clinical governance oversight to kind of roll that straight in. So is cost the number one factor? Absolutely not. Is there a cost for us to get up, to get to implement that model? Yeah, there is. Does that answer the question?
Yeah. And just on that, so I know you can't put a figure on the cost, but if we have to find money to run these services, we'll have to do a budget revision and probably have to cut services elsewhere. Is that correct?
Yes, there will be a cost associated, but that's not in the budget at the moment, but would require a revision.
I think we've given us a
A fair flogging, I would have thought.
Someone
I'm
prepared,
tired, whip hand.
is anyone prepared to move a motion?
I'll move a motion that council maintains the MCH services in its current form.
Anyone prepared to second that?
I'm happy to second it.
Seconded.
Yeah, I'll test the strength of the meeting, Mr. Chairman. I'd like to move that the council endorse the transfer. Yeah, point one.
So no,
Point one and two.
it's opposite, isn't it?
It is, I will take that as an opposite. So what I will do is I'll take the motion that we've received, and if it fails, I'll allow a subsequent motion, and I'll take you as foreshadowing the motion. You happy with that, Tom?
Yep.
Okay, the motion is moved. The speaker wishes to speak.
Would be surprising on my behalf if I didn't speak, Mr. Mayor. This whole issue to do with MCH has been a pretty emotional issue, not just for the council and us around the table, council officers, but also throughout the whole community. And I think it's one of the topics that's generated a lot of community discussion. As we're aware, we've had 3 community consultations, and with a whole range of community members who've been for the change or wish to maintain the status quo. The reason I've put forward this motion is on a number of levels. The first one is, right now, the system that we currently use is not broke. It's the old expression, if it ain't broke, don't fix it. You can modify to make the carriage a bit more comfortable, but I don't see why we have to get rid of that whole carriage. There's basically, and no one around this table has said that there's any major faults with the current system. We've highlighted the fact that in the future there may be changes, but right now those changes have not been forthcoming, and we don't really know what they might be nor when they might come through. And if that happens, then there's no reason why council at that time can't revisit the whole provision of MCH. We've highlighted or suggested that West Wimmera Health Service be our preferred inheritor of the service. And I do believe that if we do withdraw from the service, that West Wimmera Health Service is the obvious person to inherit that. However, and I'll quote from the CEO of the West Wimmera Health Service just yesterday or today on the radio, saying that they've taken over aged care from West Wimmera Shire and that they are currently having some teething issues, and that was put on ABC Radio, particularly to do with some of the volunteers and things like that. I would prefer us to not proceed, allow West Wimmera Health Service to fully implement the integration of the aged care service and to get that under control. And bearing in mind that it was only on the 1st of April that they took over the MCH practices from Yarriambiack Shire, I would prefer to see those two services be fully bedded in and implemented before they are tasked with taking on our own MCH services. I do believe that now and in the past, our clinical governance has certainly been adequate. And I don't believe that there is any cause for concern by any clients that they haven't received the best and most professional services that can be provided. And so I don't believe that that's a reason to move. To do with vaccinations, there are the proposal that we may withdraw vaccination services is almost a veiled threat, and it certainly hasn't been supported by evidence, and I don't believe that's really part of the whole discussion. But overall, I believe that the MCH services provided by our dedicated and qualified professional staff has been exemplary, and I see no reason why we should change until conditions not force us, but encourage us more to look at alternative implementers of the service. Thank you, Mr. Mayor. I've done my 3 minutes.
A second to wish to speak?
Yeah, so I attended the Kaniva and the Edenhope meeting and then had follow-up discussions with people after those meetings, and then, via phone. I also spoke to people at Coffee and Chat about this issue too, which included another past midwife. So 3 past midwives / maternal child health nurses chimed in on that conversation. So I suppose the general feeling from those people, and they were the key stakeholders largely who attended the meetings that we had here. They were the users of the service mostly. I don't necessarily feel that they left feeling that they did have the confidence in West Wimmera Health Service. There was a number of issues that were faced, and one which was quite concerning was one lady telling me that she was having sleepless nights over this decision because she was that concerned into the future. So I'm sure there are legislated changes coming, and maybe we should be, thinking about that afterwards. In regards to the lone worker safety issue, the past midwives I actually spoke to said that they actually did not feel that that was a concern, and I know how I felt going into some of those houses too. Just as a community member, I didn't feel unsafe. The other thing with it is that one of the concerns is definitely that if we transfer this service and then that fund, and then, we know that the state government's broke, and then that funding is chopped, where's the service going to be trimmed from? So there's a lot of concern around that. I think we probably are getting it out of perspective because these maternal child health nurses, they are actually qualified professionals. And we're talking about, babies largely just reaching milestones. I guess the other thing with it is the main messaging that came through was very much that we want to keep local services local. And I know they say that there's going to be no changes happening, but my concern as well, and this was said by other people, was at the moment, right, we've been forced to get rid of aged care services pretty much, and maybe we'll be forced to get rid of maternal child health in the future. We've got rid of youth, we then get rid of maternal child health, then we get rid of childcare, we get rid of the kindergarten, and it does feel like we are asset stripping. So then what's left? We do parks and gardens, we can just contract all of them out, roads can be contracted out. I just think we need to keep the services local.
Anyone else wish to speak?
Yeah, I will. Yes, thank you. Hang on, I've got something for you.
You fallen against it.
No, I'm actually going to speak against. And it's not easy because I understand the emotion that is attached to this, and I've been hearing the pros and cons. We've had something for 30 years, or I'm not sure how long actually, but I think back, I know as a mother, being in this shire, 30 years ago, this service was running, in fact, 32. And it's obviously been an extremely solid service, not a lot of change other than just what mums and what we've needed. I do have concerns. This is been raised. I do understand one thing that has changed in that time are regulations, and I do understand it's the world we live in of risk. I understand that we are talking about very vulnerable people and a very vulnerable area. We're talking about young mums that could have 3 and 4 children. You lack sleep. It is a really tough time. And the positives we have though is we have the technology that has gone forward, and the technology of being able to dial up and have meetings on computers and being able to access further health, in Melbourne and Adelaide, and communicate and being linked up to a professional body as such that has access to so much of this internally. I can actually see that the person that might live at Minimay or I'm just saying that because it's probably one of the most remote in our shire, maybe can sit at their kitchen table and have access and feel really comfortable with knowing that whatever the symptoms or whatever's going on, and they don't have to pack everyone up and go further. I have total respect for what's going on with the staff that we have here and have had over the last how many years, total respect. What I know here, or what I've been told, that those staff we will keep. The only the only thing, we're still going to have their passion and those, the only thing is we're going to take the risk out so that they can do the home visit and have a second person with them. The immunisations, the training will be there. There won't be any risk. I don't know I know of course with the immunisations, but exactly the process and where we could be lacking or what we might have to invest to go further. I want to keep all the services that we have in our shire. I want to keep the services to people, whether we have to have a professional governance body that runs it. I think that we deserve that when we live where we live. We deserve to have that and have that banner. So it's the way our world's going. One slipper and our heads are on the line. I think we owe it to our people to have service that might be able to just hook into something further to help and give that confidence and give that reassurance of what could be going on in within the family. When we're talking about paediatric assistance that we can just, this model can just access, that's there at your fingertips. It could be speech therapists, it could be. I just think that this is a channel that could be, well, I believe it it could be very positive. So I don't want to pull us back from that and also pose the council at risk. When we talk perhaps getting our governance to speed, or the overarching body to speed, we know the costs in things, and I don't know where this will end. And one thing I've learnt today, that this service, there's a fair chance it's not going to remain. It's not going to be what it is today going forward, because we obviously have to tidy that overarching the body that this sits under. We have to analyse and make sure that things are. There's no risk to this organisation. So I'm going to, at this stage, that's where I sit.
Dom, you wish to speak?
Yeah, thank you, Mr Mayor. I'd like to say that I respect the three previous speakers. Something that hasn't been mentioned. As soon as you switch the wireless on now, there's litigation and medical practices. While we're nowhere in that vicinity, I just hate something to go wrong and for us to get involved in that. So, at this stage, thank you, Mr Mayor.
You, Tom? I'll also say this is just not an easy decision to make. And a lot of this comes down to trust. People have a lot of trust in us at the moment running the service. I find it actually quite amazing that people trust us more than a health service to provide a health service. I don't know what that says about the health services or what that says about us. I'm not sure. Look, I know people have a really strong connection with their MCH services. I read a report that By5 had done where they interviewed a lot of young mothers across the region, across the entire Wimmera, and it really struck you how important the role the MCH plays in both, their birthing and their support afterwards. It's just such a crucial support. But the one thing that stood out to me reading that service, never, ever, ever does it mention whether it's a hospital-run service or whether it's a council-run service. There's no distinction. The service was loved all the same by all parents. I don't think, as some people are suggesting, that if council doesn't run this, that we're going to lose MCH. I don't think that is even on the cards. I think that's fear-mongering, and I don't think that is at all what will happen. I think we have to be aware that we are putting our trust in another provider. And again, we will lose control, and that is a concern. That is a worry. And it is the one thing that I really do struggle with. And I'm still not quite sure which way I'm going to vote on this. Look, it is a very tough decision. We have to do what is in the best interest of our ratepayers. We have to do what's in the best interest of our families. But we also have to do what's in the best interest of ourselves. We sit here as a board of directors, and we are well aware of what the risks are. We are well aware where we need to tidy things up. We know if we stay in this, there is going to be some major changes. It's not going to be the same service that everybody thinks it is now, unfortunately. We just are too aware of the risks now to let it continue like that. We'll see how I vote. Okay. Does the mover wish to sum up?
Yes, I might just say a few words in following up from what the Mayor said. We are probably facing changes, whether they're changes of our doing or from outside. By retaining control over MCH, the council can implement those changes as we see fit. Once, as we've discussed, if we hand over this service to West Rimmer Health, we lose all control and any influence over the way that service may be managed into the future. And it's also been said that once we hand it over, no matter what happens, we would probably never have the opportunity of taking it back if West Rimmer Health decided they couldn't continue with the service into the future, would be unlikely to be offered to have it back. So by keeping it local and by supporting our own community, we retain control, we retain management, and we retain that very unique local contact, the local service that people within our shire have learnt to and have come to appreciate, to enjoy, and to rely upon. So I'm hoping that my fellow councillors will support my motion that council retains the MCH service until we are forced or otherwise to revisit this whole area. Thank you, Mr. Mayor.
We'll do the vote then. All in favour? All opposed? The motion-
Division, please.
Division, all in favour? Councillor Hicks, Councillor Hobbs, all opposed? Councillor Houlihan, Councillor Mear, Councillor Pretlove. The motion is lost. I did say that I would allow a subsequent motion. Councillor Houlihan, you foreshadowed a subsequent motion.
Yeah, I'd like to move the officer's recommendations, please.
Is anyone prepared to second that? Seconded by Councillor Pretlove. Do we need to have the debate again?
No.
Nobody else wishes to speak?
No, good God, we've said enough.
We'll put it to the vote then. All in favour? All opposed? That is carried.
Division, please.
Division, all in favour? Councillor Houlihan, Councillor Mear, Councillor Pretlove, all opposed? Councillor Hobbs, Councillor Hicks.
Good. They might say in High Court, God have mercy upon your souls.
Oh, dear. It's not easy, eh?
Death sentence at MCH.
It's gone out of council's hands before and it came back.
Sorry?
It's gone out of council's hands before and came back. The death sentence. We'll still be here. 14.3 corporate card credit policy. Credit card policy. Sorry.
This is a cyclical review of our corporate credit card policy. The policy is attached. Very minor changes, changing the names of or titles of some responsible officers, dates, the addition of the reference to the overarching governance principles, and that's the extent of the update.
Any questions on this?
I'm happy to move the officer recommendations we adopt the revised corporate credit and purchase cards policy. Mr. Mayor.
That's moved. Is anyone prepared to second? Seconded by Councillor Hobbs. Do we need to discuss this matter or does anyone have any questions? We've already moved, so put it to the vote. All in favour? That is carried. (15.1) Planning Scheme Amendments. Flood controls in the West Rimmer Planning Scheme.
Thank you, Mr. Mayor. Also have Manager of Planning and Environment online, Nicole, if we need to ask questions. But this item relates to a recommendation that we proceed with the amendments to the planning scheme to incorporate flood overlays for Harrow and Chetwynd. So the flood investigation works were completed back in 2017 and 2018 for these localities. As part of a planning scheme review, it was identified that they hadn't yet been incorporated into the planning scheme, and it became a priority of council to do so. In July last year, we were successful in, or August last year, getting funding from the Department of Transport and Planning to enable assistance with the drafting of these amendments. And that work has been done. The maps have been prepared. All the documents have been prepared. We're now at a point to move it along with a recommendation to refer it back to the minister for their consent, and then they will do a panel hearing and go through the necessary processes to implement the amendment into the scheme. That body of work alone will save council a fair amount of money in terms of it's an alternate or a streamlined process back through the minister's office to get this done. It will strengthen council's controls in the planning scheme for those two localities. That will identify the extent of flooding in a major flooding event. They've nominated the 0.5% annual exceedance probability, in old language, 1 in 200 year flood, as the line on the maps. Also will be amended is the land subject to inundation, which is currently in there. So it strengthens that provision. There's a recommendation there. It's quite lengthy and I'm not going to try and read it out. But
No, I don't have long enough to hear it all.
Any questions on this matter?
I'm happy to move the lengthy officer recommendations, Mr Mayor, which I note are in part 1, 2, 3 and 4. You can be read on the council website and save my voice.
I'm happy to second this.
Second by Councillor Predlove. Anyone wish to speak to this?
Yeah, just briefly, if I may, Mr Mayor, can I first of all thank Brendan and his teams for preparing this very detailed piece of work. It's an essential document that council in the past has not had, and it's been an obvious omission or a document that we should have had within our portfolio and we haven't. And so I commend you and your team for preparing it. We know that it's a document that will not be regularly revised, but it can be revised and reviewed as situations may change. For example, if suddenly climate change decides it's not going into a dry period, but we're going to have a flood period and we'll all be building Noah's Arks. But it's a great piece of work. I look forward to seeing the next 2 documents that form this overall flood control package. And I'm very happy to move the motion with your recommendations.
Second, wish to speak?
I just support Councillor Hicks's comments. I think, and also that this is something we need to, update, support our, the part of our planning scheme. The last thing really we want to be doing is giving out, or not having listed back the reasons of why permits and things and where things should be given and where they shouldn't. So I think it's an important document and I support it. Thank you.
That's all I have.
I'd like to speak against the motion. Having read this, the big thing about the flooding of the Glenelg River and Shetland River is a disgraceful position the waterways have let be go into. You look at the Shetland River, just full of combustion. It's full of combustion. Just absolutely, if there's any reports to be done, the first thing they've got to do is report on how the Kambungi, the waterway's got to be cleaned up. And it just floods with a slight rainfall. Glenelg River, management there's a little bit better, but only a little bit better. Thank you.
Anyone else wish to speak? I will just speak to support the motion as well, although I do wholeheartedly agree with Councillor Houlihan that Kambungi is a major issue and does help caused the flooding, unfortunately, and they should do something about it. The council is aware that there is flooding issues that do occur in these towns. We've seen the overlays presented to council. We've had the water authorities tell us in the past. Council is aware of this. We've been talking about risk management already today. We need to have this in the planning scheme for risk management. Does the mover wish to sum up?
No, thank you, Mr. Mayor.
Put it to the vote then. All in favour? All against? That is carried.
Division.
Division was called. All in favour? Councillor Hobbs, Councillor Hicks, Councillor Pretlow, Councillor Mear. Opposed? Councillor Houlihan. 15.2, planning permit application PA 1196.
Thank you, Mr. Mayor. So again, we have a planning permit application in front of us for determination. I do have online the manager of planning and environment, and also the consultant planner, Sam, is also online. Take the report as read. Just to sum up, the recommendation is recommending that council issue a notice of decision to refuse. One of the referral authorities is the Glenelg Hopkins Catchment Management Authority, also objected to the granting of the permit. I might hand over to Nicole or Sam, who has written the delegate's report and spent probably the best part of their last 2 months going through this. So, Nicole, would you like to add any further?
I think based on what you've already mentioned, Brendan, and just what we've talked about previously in our previous agenda item regarding the flooding, we are, I guess, taking the advice of the Glenelg Hopkins Catchment Management Authority in this space, where they have advised that there isn't a safe location on that site to be able to build a residential dwelling, given the flooding level that does occur on that location.
Are there any questions? Tom, you got a question?
Yes, a question. Glenelg Hopkins Catchment Management Authority, they provided advice on the officer's recommendation. Is that correct?
No, it's no the other way.
Sorry.
Yeah, Brendan.
So they're a referral authority. So council, as part of our assessments, required to submit the application to them for their input and their comments, and then they've come back to us with their recommendations, and they're incorporated into our recommendations.
Thank you.
So am I right in saying that they gave the recommendation first, as they're the professional body in charge of catchment management, and we have reviewed and agreed agreed with their assessment. So it goes to them first, and then it comes back to us. It's not us first and then to them.
Yeah, and I'll probably sort of just highlight that that's one part of it. The other part is assessment against all of the requirements of the planning scheme. And so that's the work that our planners have done, and then the Catchment Management Authority is a part of that as well.
Any further questions? If council was to grant this planning permit, is it likely that Glenelg Hopkins could then object?
They have the ability to object. I guess we don't know what they would decide to do. So should we grant it, as they were an objector in the referral process, they would have the opportunity to appeal it at VCAT. Just as if we were to refuse it, the applicant has the same opportunity to appeal at VCAT. So either way.
Thank you. No good looking at me. I can't move anything.
Oh, I know. I'm waiting for someone else to leap forward. It always seems to be me. I'm looking forward to another guinea pig.
Is anyone prepared to move anything? We have a recommendation.
I'm prepared to move the officer recommendation.
I'm prepared to second it.
That is moved and seconded. Does the mover wish to speak?
Look, I believe, I think it's all in front of us, but that this planning permit application there's risk on us granting this on a lot of grounds, and I guess too the fact that granting the Glenelg Hopkins Catchment Management Authority has also objected granting the planning permit says a lot. I know that that doesn't say everything. I know that that can be, challenged. I totally understand that, but I do believe, we have to. It's our job to take everything into consideration, and I think just looking at the site, it does look quite obvious that it could be a decision that would come back to bite if this was granted by us as councillors. Thank you.
Second, I wish to speak.
Thank you, Mr. Mayor. I think that over the last year or two or three, we're all well aware of issues, particularly in New South Wales, with flooding and with damage and destruction to housing that has been allowed to be constructed on known areas that have been subject to flooding. You may argue that those areas might be a 1 in 100 flood or a 1 in 50 flood, but they are still areas that are prone to flooding. In this case, the management authority has objected on the grounds that those blocks are subject to flooding as far as their professional assessment and their documentation show. I think it would be extremely frivolous of us to override their opinion. They are the Catchment Management Authority, and they have a considerable degree of authority and legislative power behind their determinations. That doesn't mean necessarily we have to always agree with them, but I think if we if we don't always agree with them, but if we wish to disagree with the Catchment Authority, we better have a bloody good reason. And I think with Brendan and staff have very carefully assessed this application and determined that it's inappropriate to grant the application on other grounds, but also including the recommendations from the Catchment Management Authority. So whilst it might be very disappointing for the applicant, I think we would be can't think of the word. It would be to the detriment of council to approve when we believe, and our own assessments show, that this area is on a flood catchment, a flood zone.
That's all there.
I will speak against the motion if I could. Glenelg Hopkins Catchment Management Authority. The last time this area was under flood was approximately 14 years ago. I was on the building committee for the new Harrow Hall also, the Harrow Hall. Behind that was a flour mill. When we built the new hall, we built it at a height that the flour mill had never ever been. Well, not quite the height of the old flour mill, but the flour mill never ever went underwater. the new hall is on a height that has never been underwater, even though 14 years ago, when we were under flood, this Glenelg Hopkins Catchment Management Authority opened the weir at Hopkins and let more water out. We had a meeting in the hall, the water's rising round us, and we got the water stopped. So I'm saying be careful of Glenelg Hopkins Catchment Management Authority. They're not the know-alls and the do-alls they think they are. I think I'm pushing for a permit to go to this house, but it has to be built on the same level as the Harrow Hall. That the new hall's never had water in it, and it can be controlled if the Catchment Management Authority do the right thing. You've just got to be careful in Harrow. At the moment, you've got a town on 5 levels. The moment you're blocking, you've got a motion on the books to block a building permit on level 1, and there's already motions at level 5, not motions, laws stopping us from building on level 5. I don't know where you're trying to take Harrow, but I'm asking you to reconsider this one and allow this house to be built, but it's got to be at the same level as the Harrow Hall, which is never, the new Harrow Hall's never been underwater. We carted in an enormous amount of soil and built it up. And I'm just saying, if we put a house here, it's got to be at that height. You know, you've got to give Harrow a go. You can't, level 5, you've got us blocked out, and now you're blocking us out at level 4. I think I really have a good look at the direction you're taking the town in. Thank you.
Thank you. Can I just ask a question there, Brendan? The properties that Tom may be referring to on level 5 are farm zoned and are under the 80 hectares for minimum for an automatic house to build, the right to build a house. But can they apply for a planning permit and be allowed to build a house?
That's my understanding, and Nicole will check with Nicole, but
Yes.
as of
Yes.
right, not there, but they can with a planning permit.
Yes, that's right.
Yes, they can apply for a planning permit to build a house in the farming zone.
Yes, I think we just need to make that clear, and so everybody in the public can actually hear that, because
That's not correct. David, you were with me. We went out, looked at an area where a chap had been applying for 2 years. In the finish, he just gave up and went back to Adelaide. He was going to start a business there. We had a look, just could not get his permits through the Shire to build. That was in level 5.
I believe council since changed our delegations and our process, that if they're given an automatic no, I know it's too late for him,
No,
but that is no longer the case.
Or any intention to refuse comes to council. So that's the process. It's in place now. So if there's an application for a permit and the officer recommends a refusal, it will come to council for decision.
Yeah.
Mr Mayor, we've got people bridges. We're trying to build houses in Harrow, and the Shire is blatantly stopping us. Thank you.
Does the mover wish to sum up?
Yes, I do. On the basis of the application that we have in front of us, I cannot support granting the application. And just a comment, I've often wondered and been quite amazed how local councils within the region have permitted grants and granted, for buildings and development in areas that appear to be low-lying. I've often wondered what on earth happens and where does insurance come in? What leg do people stand on? Who do they come back on? obviously the council that grant it when it goes pear-shaped. The force of water is ridiculous. I just, you know, I can understand why we've got 9 parts of this grounds of refusal, because just to look at that location and, you know, and it just looks as if it's probably
A bit wet.
a bit, yes, it can get a bit wet. So I'm happy to, I'm very supportive of this. Maybe, you know, the application in another way might work, I don't know, but with what's in front of us, I'm happy to support. Thank you.
Put to the vote then, all in favour, all opposed, that is carried.
Take the names, please.
The division's called, all in favour, Councillor Hobbs, Councillor Hicks, Councillor Fretlow, Councillor Mear, all opposed, Councillor Houlihan.
Almost dinner time, we don't hurry up. Mr Mayor, I thought cattle be starving.
You're going to get into used to quick meetings. A bit more on the agenda today. 15.3, the small town plan draft for community consultation.
Yeah, Mr Mayor, so just quickly with some background on this one. Council's been successful in securing, again, funding, external funding to progress some more strategic planning work for part of the planning scheme. So this work is made up of 2 parts. One is the development of small town settlement plan, which is what's been presented today, going out for community consultation, and following that will be, well, the funding will allow the development of the structure plan, a settlement plan for the Kaniva structure plan, and then a settlement plan. So it's a sequence of events there. We've said this before, council's got of a mind to get some of the zones rechanged or rezoned to be more appropriate in each of the towns. So to affect that outcome, this body of work has to be sort of presented to the department. There has to be these panels, there has to be lots of consultation. This is sort of step 1 of about a 10-step process, if you like. I think the document has been already briefed to council. It's been out for initial public feedback. There's been a survey, I suppose, which has informed the document, and it's now going back out again. So that sort of highlights the level of consultation that is part of this. And again, this is only for presenting it for commencing consultation. We'll come back to council again following that.
Any questions?
I'm happy to move them off as a recommendation.
Before we go any further, I do have one quick question though. I do note in the plan itself that they show town boundary maps in that, but those boundary maps don't align to our local laws town boundary maps that we passed. So which are our town boundary maps?
So can I perhaps take that as a comment and the feedback, and the question might be how do
I can answer that one for you if you'd like. So I guess going back to the time of the town boundaries that we did for the local law, we did offer up the ones that are listed in the planning scheme. However, councillors wanted to change some areas and include some things, so they are purely for the purpose of the local law and the and the enforcement of our local law. So that is what we class, you know, as the town boundary and within the town for the sole purpose of the local law.
Right, okay, thank you. So if we want to change our town boundaries as they apply in the planning scheme, that will require a planning scheme amendments.
Yep, and they are some things that, you know, feedback can be received on in this small towns plan.
Well, some of the recommendations do actually refer to that, so yeah, that's fine. Yeah. It was moved by Councillor Hicks. Is anyone prepared to second that? Councillor Hobbs has seconded. The mover wishes to speak.
Just a quick comment. As Brendan has stated, this is really the first stage of a multi-step process, and I thank Brendan and his team for preparing and working with the consultants in the preparation of this plan. It's now going out for community consultation, and I implore the community to read it very carefully and make appropriate comments back to council, and we will consider those community comments in the drafting and the finalisation of the plan. It's important that the community understand the town plans, has a buy-in to it, and realising that it's a document that will be referred back to many times with many grant applications and other council activities into the future. It's important we get it right. We have this opportunity with Brendan's team and with the consultants, and it's great to see it go out for community consultation. As I said, it's important that the community feel involved with what council is doing, and this is an opportunity for them to make comment. We look forward to receiving their responses. Thank you.
Second, would you speak?
Yeah, just want to support Councillor Hicks's comments in that, and thank you to the staff. I know we put an incredible amount of work into it all to get it to this stage, and do encourage the community to read that document and comment on it.
Anyone else wish to speak for or against the motion? Not. Mr. Mover, wish to sum up?
Nope. Thank you very much.
Put to the vote then, all in favour? That is carried. We'll move to 15.4, the asset management plan review.
Mr. Mayor, what's in front of council today is the draft asset management plan, to go out for consultation in accordance with our community engagement policy. The Local Government Act 2020 requires council to keep in force or adopt and keep in force an asset plan. The plan should be reviewed in the first year after the election, hence why it's coming to council today. James has been heavily involved in doing that review, so James is here if you've got any questions. I guess it is a key document for council. We've got something, how many hundreds of millions of dollars of assets?
200 and a quarter of a billion.
It's under management, if you like, and this plan guides our decision making in terms of our asset renewal program and our maintenance programs. And it is sort of the Bible on how we allocate funds and priorities. And I'll probably leave it there and might ask for questions.
Are there any questions?
I'm happy to move the officer recommendations.
Motion's been moved. Has anyone read the second? Councillor Lamb, seconding?
Yep.
Does the mover wish to speak?
Briefly, if I can. It's not always possible. It's an important document. Thank you, Brendan, James, and your teams for preparing this and for the next matter that we'll be dealing with. These are important documents, and again, I implore the community to buy into these sorts of activities, to read the policy, and to comment where appropriate, because it will be an important document that the council will constantly refer back to in the coming years, and it's important to get it right, and it will have influence and effect on things like grants for future asset management, and the next one to do with roads for the same way. These are documents that we need to have, they need to be right, and we refer back to them and use them to our advantage in the appropriate management of the Shire. So thank you, guys. That's it.
Second to wish to speak?
Asset management, a very large part of our business. Something that we've got to take care of, and I thank the staff. So, thank you.
Anyone else wish to speak? No.
I will actually. I think it's good. Thank you to James' team for getting it together. But I think we've come far enough. It's a document in progress process. So it's the next stage. We have to get it out to the community, and I'm sure there'll be some tweaks and changes, and it has to align with our plans going forward with the management and the direction that council takes. So
I think we're at the stage to move it forward. Thank you.
Thank you. Who wishes to sum up?
No, thank you.
If not, put it to the vote. All in favour? That is carried. 15.5, the road management plan review.
Thank you, Mr Mayor. Similar to the last report, council has an adopted road management plan and we're required to review it every 4 years. The road management plan is the management system that we utilise that drives how we inspect and maintain our road network. So it includes the policies, objectives. It sets intervention levels in relation to defects in the road. It sets our inspection timetables for how often, how frequently we have to inspect all of the network. You would all be aware we've got a very large network of roads. I think if you stretched it out in a single line, it would probably get you to Perth. So if we say we're going to inspect it every 6 months, it's the same as driving to Perth every 6 months and looking at all of the roads. So
Weather's warmer there.
actually probably longer by the time you get around the network and the binary system. So this has been out for public consultation and it's now back ready for council. The next stage is for council to adopt it, and we have to then place notice in the Government Gazette and locally circulating newspapers and on council's website. So that's prescribed in the Act to adopt the plan.
Are there any questions? Someone prepared to move?
Oh, why not? Just to be different, I'll move the motion.
It's moved, and I'm prepared to second. Councillor Hobbs. Righto. Is there anyone wish to speak?
Yeah, just a quick comment. Again, Brendan and James, many thanks for your very detailed, very professional input into the preparation of this document. It is important. Again, it's been out for community consultation, as Brendan's mentioned. It's now back to the very bureaucratic part of the pathway to be gazetted and then put on our website. But it's also a document that we will refer back to when we're applying for grants in terms of road maintenance, road repair, road upgrades and things like that. It's only done every 4 years. And so again, it was important to get it right, which I certainly believe we have done, thanks to Brendan and James and team. That'll do.
Second wish to speak?
Yeah, no, I agree with everything that's been said, and I think it goes without saying as to, you know, how important the roads are to West Wimmera. So,
Onward and upward.
Put it to the vote then. All in favour? That is carried.
Mr Mayor, with your indulgence, I'd also like to just let council know that it's James' last meeting with council.
Oh no!
Or he's impending retirement.
Where's the beer?
I've been looking for it.
Yeah, well,
We won't be out.
sorry,
for
much
another
of
half
the
an
constraints.
Whoever goes along next.
Oh, sorry to see you go, James. Thank you very much for your input over the last few years.
Yeah, 4 years. Thank you.
How many years at Gary?
31.
All the best.
I was still in nappies when you started work, obviously.
Yeah.
But you just recently moved out of nappies. Yeah, just a little bit retarded.
So
Thank you, James, for all your contributions. It's very much appreciated.
Thank you,
Yes,
Mr. Mayor.
thank you.
Right, we have item 16, the ceiling schedule, which we have none. 17, we have no late items of business. We now move to confidential. Someone prepared to move the recommendation, moved by councillor Pregler, second by councillor Houlihan. All in favour? That is carried. Hearing confidential, I